Do you know what blood clots are and why they can be dangerous? In this video, we'll explain what causes blood clots, how to recognize the symptoms, and what you can do to prevent and treat them. Blood clots are a serious medical condition that can affect anyone at any age. Blood clots can form in your veins or arteries and block the blood flow to your organs, causing damage or even death. But don't worry, there are ways to prevent and treat blood clots, and we'll tell you all about them in this video. But before we get started, make sure you hit the subscribe button and the bell icon to get notified when we post new videos. And if you find this video helpful, please give it a thumbs up and share it with your friends. Now let's get into it. What are blood clots? Blood clots are semi-solid masses of blood that can either remain stationary, which is called thrombosis, or they can break loose, a condition called embolism, and travel to different parts of your body. Blood clotting is a normal process that prevents excessive bleeding when you get injured, but sometimes clots can form when they're not needed or don't dissolve properly. What causes blood clots? There are many factors that can increase your risk of developing blood clots, such as having a family history of clotting disorders, having certain medical conditions such as cancer, diabetes, heart disease, or stroke, having surgery or an injury that damages your blood vessels, being inactive for a long time such as bed rest, travel, or sitting, taking hormones such as birth control pills or hormone replacement therapy, smoking, or being overweight. What are the symptoms of blood clots? The symptoms of blood clots depend on where they are located and how big they are. Some common signs to look out for are swelling, pain, redness, or warmth in your arm or leg, shortness of breath, chest pain, or coughing up blood, severe headache, dizziness, or vision problems, abdominal pain, nausea, or vomiting. How to prevent blood clots? The best way to prevent blood clots is to stay active and healthy. Here are some tips to follow. Exercise regularly and avoid sitting for too long. Eat a balanced diet and drink plenty of water. Quit smoking and limit alcohol intake. Wear compression stockings if you have poor circulation or varicose veins. Follow your doctor's instructions if you take blood thinners or have a medical condition that affects your blood clotting. How to treat blood clots? If you suspect you have a blood clot, you should seek medical attention right away. The treatment options for blood clots depend on the location and severity of the clot. Some common treatments are anticoagulant medications, also known as blood thinners, that prevent new clots from forming and existing clots from growing. Thrombolytic medications, also known as clot busters, that dissolve the clot and restore blood flow. Surgical procedures, such as angioplasty, stent placement, or thrombectomy, that remove or bypass the clot. So that's all for today's video on blood clots. We hope you learned something new and useful. Remember, blood clots are serious but preventable and treatable. If you have any questions or comments, please leave them below. And don't forget to subscribe, like, and share this video with your friends.